Hi everyone, I'd just like to say thank you to our fantastic volunteer team for all the work they've been doing helping keeping RCHT going in the face of COVID.
A big thank you to the Children's Community Therapy Service team.
Hello, Wendy Perkin, the name nurse for Safeguarding Children here. I just wanted to take this opportunity to say a huge thank you for all the amazing Safeguarding Children work you've all been doing through this difficult time. Just wanted to say some special thanks for the staff on Paediatric ED, Fistral, CCU and Dawn and Mark Scallon. Thank you, keep up all the lovely good work.
Next, we have a selection of emails from staff wanting to say thank you to their colleagues. Angela Jenkin would like to say a massive thank you to the accounts payable team in finance and all their finance colleagues that have supported them. They have worked tirelessly to maintain payments to suppliers, to enable medical equipment and supplies to be provided to maintain patient care in this difficult time. They have supported each other amazingly, whilst quickly adapting their work methods to get orders paid for and supplies delivered. Caitlin MacDonald would like to highlight Dr. Cyrus Shabley on the acute medical team, who has made a particular effort to look out for junior doctor well-being, ensuring that they have adequate rest and that they have support whenever needed. Hayley House says that the St Michael's therapy team would like to say a big thank you to their therapy team lead, Sally Bolton, for supporting the team through the transition at St Michael's Hospital from elective orthopaedics to trauma. Also, for working together with our Duchy, outpatient and trauma colleagues to create one therapy team. Philippa Robbins would like to say a massive thank you to the amazing team in radiotherapy for pulling together during such difficult times, for taking all the numerous short notice changes in their stride and continuing to provide a high quality service in radiotherapy in a safe environment for their patients. Just a brilliant team to be a part of. Dr. Grant Stewart would like to praise the staff in the Headland Unit and the Sunrise Centre. They're giving such excellent care to their cancer patients with chemotherapy and radiotherapy, and are doing it all so kindly and thoughtfully. It's especially hard for these vulnerable patients to be isolated at home and to have to come to hospital for their cancer treatment. The nurses, radiographers and support staff are doing an amazing job. Michelle Jerry would like to extend a massive thank you to Sister Shelley Jackson at St Michael's Hospital, along with all the current Band 6s working hard to ensure the change in their services run as smoothly as they can, while being under immense pressure due to staffing changes and role changes. Shelley works extremely hard, is always available even on her days off, and gets hands-on to show that no matter what band you are, St Michael's isn't just a team, it's a family, and they're in this together. Shelley is a massive credit to her profession and is not only a great ward manager, but a leader, mentor and friend to all who work with her. Justine Gray would like to send a big thank you to all our colleagues in the post room at RCHT who go about doing their deliveries to all areas of the hospital, and she doesn't even think she's heard any of them complain. They are always bright and cheerful, and it certainly breaks up the stress of her day when she hears the friendly knock and sees a smiling face. They all have a great sense of humour, which is invaluable during these challenging times. It's a temporary reprieve from the crisis. Personally, she feels that they are overlooked because they just go about their duties without a fuss and are just there. Please can you put a thank you out to them? We can't live without them. The ACCT Care Group Quartet would like to say thank you to the pain management team for their continued amazing work in training staff in epidurals, PCAs and LAs during the pandemic. Karen Godfrey would like to nominate Martin Rodder from the trauma unit. He has done an amazing job in the past few weeks training and assessing staff from trauma and other teams in his care group on transfusions and collecting blood from the fridge. Jenny Sinclair would like to say a huge thank you to the fabulous team who have been operating the coronavirus helpline. As a team, they've worked tirelessly for the past 6 weeks to ensure that staff from RCHT, CFT, Kerno Health and Mighty have access to the information and support they need. With some understandably anxious callers and ever-changing advice, they have done an incredible job. Shelley Jackson would like to say thank you to all the St Michael's Hospital staff, literally everybody on site, who have worked tirelessly for the last month providing the trauma service. The change happened in 3 days, and every member of the team have worked their socks off. They have also remained cheerful and welcoming to all the new staff that have joined from Duchy Hospital, Trauma, Kernoflex, and the various agencies. And lastly, Johanna Gilbert would like to thank medical staffing, ID badge service, IT, occupational health, and postgraduate medical education teams that have conducted a streamlined version of induction for our volunteer interim foundation year ones. We're excited to welcome the new doctors to RCHT, but couldn't have done it without the teamwork of the departments supporting the induction process. Thank you.